The pain hit me like lightning, sharp, crushing, radiating down my left arm. I was 3 hours into a complex cardiac surgery, my hands inside a patient's chest, and I realized with absolute certainty that I was having a heart attack. Right there, in the middle of the operating room, with a man's life literally in my hands. I had two choices: stop the surgery and potentially let my patient die, or keep going and risk dying myself on the operating room floor. I'm Dr. Michael, and I've been a cardiac surgeon for 16 years. I performed over 2,000 heart surgeries. I've saved countless lives. But that day, I had to make the most impossible decision of my career: save my patient or save myself. If you want to know how I made that choice and what happened in those terrifying minutes, subscribe now. Because what unfolded in that operating room will challenge everything you think you know about dedication, survival, and the line between heroism and recklessness. Let me take you back to the beginning of that day. It was a Tuesday morning. Routine. I'd had my coffee, reviewed the surgical schedule, felt perfectly fine, maybe a little tired. I'd been working 60-hour weeks for months. But that was normal. That was the job. My patient that day was Richard Torres, 58 years old, triple bypass surgery. His coronary arteries were severely blocked. Without this operation, he'd be dead within months. The surgery was scheduled for 4 hours, complex but manageable. I'd done hundreds just like it. We started at 7 a.m. The anesthesia team put Richard under. My surgical team assembled 2 resident surgeons, 3 nurses, 1 perfusionist managing the heart-lung machine, and an anesthesiologist monitoring vitals. Everything was perfect. Standard protocol. I made the first incision, the sternotomy, opening the chest by cutting through the breastbone. The saw's vibration traveled up my arms, as I'd felt thousands of times before. We exposed the heart. Beautiful. Terrifying. A fist-sized organ beating steadily, keeping a man alive. We connected Richard to the bypass machine. His blood would flow through it while we stopped his heart to operate. The perfusionist confirmed flow rates. The anesthesiologist confirmed stable vitals. "We're good, Dr. Michael." Heart stopped. "You're clear to proceed." I began harvesting the saphenous vein from Richard's leg, the graft we'd used to bypass his blocked arteries. This part requires precision. Steady hands. Complete focus. 2 hours in, everything was going perfectly. Then I felt it. A tightness in my chest. Not pain, just pressure, like someone was pressing on my sternum. I paused for half a second, took a breath. It passed. Probably just tension, probably just holding my shoulders in surgical position for too long. I continued working, but 15 minutes later it came back. Stronger this time. The pressure became pain. Sharp. Central chest pain radiating to my left arm. Cold sweat broke out on my forehead under my surgical cap. My heart rate accelerated. I felt it pounding in my ears. And in that moment, with my hands inside Richard Torres's chest, I diagnosed myself. Classic symptoms: central crushing chest pain, left arm radiation, diaphoresis, tachycardia. I was having a myocardial infarction, a heart attack. The irony was almost absurd. A cardiac surgeon having a heart attack while performing cardiac surgery. But there was nothing funny about it. I was in immediate danger. And so was my patient. Dr. Lisa Park, my first-year resident assisting me, noticed immediately. "Dr. Michael, are you okay? You're sweating." "I'm fine," I lied. "Suction here." But I wasn't fine. The pain was intensifying. My vision started to narrow at the edges. I could feel my own heart struggling. Probably a blocked coronary artery. Probably the left anterior descending, the widowmaker. The same thing I was fixing in Richard. My mind raced through the options. If I stop now, Richard dies. We're in the middle of the most critical phase. His heart is stopped. He's on bypass. If I hand this off to Dr. Park, she's a first-year resident. She's not ready for this level of complexity. If something goes wrong, she won't know how to fix it. But if I continue and I collapse, we both die. Him on the table, me on the floor. The logical choice was clear. Stop, get help, save myself, let the senior surgeon on call take over. But he was in another surgery. It would take 20 minutes minimum to scrub in, get briefed and take over. Richard didn't have 20 minutes, not with his heart stopped. Not with the bypass machine as his only lifeline. I made my decision. "Dr. Park," I said, my voice steady despite the pain. "Listen carefully. I need you to watch everything I do. Ask questions if anything is unclear. And if I tell you to take over, you take over immediately. Understood?" She looked confused. "Dr. Michael, what?" "Understood. Yes, understood." I continued operating. But I also started coaching her. Every move I made, I explained. Every stitch, every anastomosis, every critical decision. We're connecting the graft to the left anterior descending here. See the angle? 45 degrees. That's crucial for flow. The pain in my chest was excruciating now. I could feel my own heart struggling to pump blood. Each beat felt irregular, probably developing arrhythmia. I was running out of time, but Richard was running out of time faster. I blocked out the pain. I focused on the surgery. Muscle memory took over. 16 years of training, 2,000 procedures. My hands knew what to do, even as my body was failing. First, anastomosis complete. Now we moved to the right coronary artery. Sweat was dripping down my face now. The surgical nurse wiped my forehead. She knew something was wrong. They all did, but no one said anything. Because we were in the middle of a surgery. Because we had a job to finish. The anesthesiologist kept glancing at me. His eyes said what he couldn't. "You need to stop." But I couldn't. Not yet. 30 minutes passed. I completed 2 of the 3 bypasses. Richard's heart was almost ready to restart. Just one more graft. One more connection. The pain in my chest was constant now. A crushing weight. My left arm was going numb. Classic signs of worsening ischemia. My own heart muscle was dying. Cells were dying every second I delayed treatment. But if I stopped now, Richard would die for certain. If I kept going, maybe we both survived. "Final graft," I announced. "Right coronary artery to aorta. Dr. Park, watch closely." My hands were shaking now. Not from nerves. From my body's stress response. Fight or flight activated while standing still. I steadied myself. Took a breath. Made the connection. Perfect anastomosis. All 3 grafts complete. Perfusionist, prepare to wean from bypass. Anesthesia, ready to restart the heart. This was the moment of truth. We'd restart Richard's heart and see if the bypasses worked, if blood flowed properly through the new grafts, if his heart could sustain itself. It was also my moment of truth. Once Richard's heart restarted, I could step away, get help, save myself. Removing aortic cross-clamp, weaning bypass, rewarming. Richard's heart began to fill with blood again. It twitched, fibrillated, then beat, steady, strong, beautiful, sinus rhythm established, grafts flowing well, pressure normalizing. Relief flooded through me. Richard was going to make it. "Dr. Park, close the chest. Standard protocol. You can do this." Her eyes went wide. "Dr. Michael, You can do this. I've watched you practice. You're ready. Just like we trained." I stepped back from the table. The moment I did, my legs almost gave out. Dr. Park caught my arm. "Someone get a gurney. Dr. Michael is having a cardiac event." The room exploded into organized chaos. The anesthesiologist called for the cardiology team. Nurses helped me out of my surgical gown. A gurney appeared. As they loaded me onto it, I looked back at the operating table. Dr. Park was closing Richard's chest. Steady hands. Perfect technique. She was going to be an excellent surgeon. Here's where I need to tell you something important. What I did was reckless. It was against every protocol. It was dangerous. And I would never recommend anyone do what I did. If this story is making you think about the impossible choices we face, about the weight of responsibility, about what it means to put others first, subscribe and stay with us. Because the next part of this story will show you why sometimes the right choice and the safe choice aren't the same thing. They wheeled me to the cardiac cath lab. Within minutes, I was on the table I'd sent so many patients to. The cardiologist, Dr. James Rivera, was a colleague, a friend. He looked at me with concern and disbelief. "Michael, what the hell were you thinking?" "I was thinking my patient needed me to finish." He shook his head. "You could have died." So could he. The angiogram confirmed what I already knew. 95% blockage in my left anterior descending artery. The widowmaker. I needed immediate intervention. Dr. Rivera placed a stent, opened the artery, restored blood flow to my dying heart muscle. I watched the whole procedure on the monitor, analyzing my own coronary anatomy, critiquing the technique. Professional habit. "You're insane," Dr. Rivera muttered. "You're watching your own cardiac intervention like it's a teaching case." "It is a teaching case. You're doing great, by the way. Good stent placement." He laughed despite himself. "Shut up and let me save your life." The procedure took 45 minutes. When it was done, the pain was gone. The pressure lifted. I could breathe again. "You're lucky," Dr. Rivera said. "Another 20 minutes and you'd have sustained massive cardiac damage, maybe fatal arrhythmia." "Michael, you need to understand how close you came." "I know." "Do you? Because from where I'm standing, you chose to risk your life rather than stop a surgery." Richard Torres would have died if I stopped. Maybe. Or maybe Dr. Park could have managed. Or maybe the attending on call could have scrubbed in fast enough. You don't know. You made an assumption and bet your life on it. He was right. I had made an assumption. I had gambled. And I had no way of knowing if it was the right call. That night, lying in the ICU bed with monitors attached to my chest, I thought about what I'd done. Was it heroic? Or was it stupid? Was it dedication? Or was it ego? I honestly didn't know. Richard Torres woke up the next morning. His surgery was a complete success. All 3 grafts functioning perfectly. He'd live another 20 years if he took care of himself. Dr. Park came to see me. "How are you feeling?" she asked. "Like I had a heart attack," I said. "But alive." "How's Richard?" "Perfect. You saved his life, Dr. Michael." "We saved his life. You closed that chest like a pro." She smiled. But then her expression turned serious. "Why did you do it? Why didn't you stop?" I thought about that question for a long time before answering. Because in that moment, his life felt more important than mine. Because I knew I could finish. Because stopping felt like giving up. And because I don't know if I could live with myself if he died and I could have prevented it. Even if it meant you died? Even then. She shook her head. I don't know if that's admirable or terrifying. Maybe it's both. 3 days later, I was discharged. Strict orders. No work for 6 weeks. Cardiac rehabilitation. Medication. Lifestyle changes. I followed every order. I wasn't stupid. I knew I'd gotten lucky, but I also knew that luck wasn't a strategy. 6 weeks later, I returned to surgery. Different. Changed. More aware of my own mortality. More careful, but also more certain than ever about why I became a surgeon. Not for the prestige, not for the money, but for moments like that operating room, when someone's life depends on you finishing what you started. Richard Torres sent me a card. It said simply, "Thank you for not giving up on me. You gave me more time with my grandchildren. You gave me life." I keep that card in my office. A reminder. Not of heroism, but of the weight we carry, the decisions we make, the impossible choices that define us. Was what I did right? I still don't know. Medical ethics boards would say no. Hospital administrators would say no. Malpractice lawyers would have a field day. But Richard Torres is alive. And I'm alive. And sometimes, that's the only metric that matters. If this story made you think about sacrifice, about the cost of caring too much, about the fine line between dedication and recklessness, then subscribe and join us. Here, every heartbeat tells a story about the impossible decisions we face when lives are in our hands. Share your thoughts. Would you have stopped? Would you have kept going? Where do you draw the line between helping others and protecting yourself? Until then, remember, sometimes the most important diagnosis we make isn't about our patients. It's about ourselves. And sometimes, the bravest thing we can do is admit we're human. Keep listening. To your body. To your conscience. To the quiet voice that tells you when to push forward and when to step back.